Sometimes the thing that makes me really sad is that org psychs often go a little bit missing in action in conversations around how to do mental health at work, when in fact we're actually the experts. It's our jam. It's what we do. It's not immediately obvious that that's what we're doing, but even like I've been listening to some of your other guests talking about this, and you know, when you really look at how do we do mental health at work, it's really just about creating positive, constructive businesses. It's really just good organisational management, and that's what we do. So I have worked with some amazing HR practitioners and WHS professionals in my time, people who I immensely admire, think doing great work. And even they come to me and say, oh my gosh, Heather, you really need to help me with this stuff because I'm just really not quite sure what I'm doing. And I think, you know, some of the time they actually do know what they're doing, but it's a confidence thing. And in fact, I probably see 3 issues going on for organisations where mental health at work is concerned, and they're gaps that I think organisational psychologists can help to fill. So one is that confidence factor. They just need somebody there to help guide them and give them some encouragement and reassurance that they're actually doing the right things and that the things that they're doing will lead to a positive impact. Another one is capability, where in situations where not all organisations are going to have a really savvy person employed in their organisation, particularly for smaller organisations that actually do know what they're doing around mental health at work. So we can help to build capability or lend that capability into an organisation. But the other issue, of course, is capacity. So even where you do have people that have got an idea what they're doing, you know, there's so much stuff that we need to get done in organisations. And, you know, for a HR function, for an example, in an organisation, there's so much transactional and operational HR work that has to happen in order to keep an organisation running. Sometimes it's hard to find time to do that strategic HR work. It sort of takes a backseat to that transactional work, because at the end of the day, people have to get paid. We have to recruit people. We have to onboard people. And so sometimes wellbeing isn't front and centre there. And so we can, you know, help to increase capacity by being brought on either internally or as consultants to increase that capacity. So really what we're bringing in is that deep level expertise, that understanding of people to really guide the identification and management of risk to mental health at work, and really helping to educate on what would reflect good practice in any given situation. You know, whether it's, you know, any number of factors that result in stress in the workplace and how do we tackle those, or even if it's fatigue risk management, or, you know, how do we respond to issues like vicarious trauma or exposure to occupational violence and aggression, or whether it's workplace bullying. You know, we're the ones that are going to be in there going, you know, the intervention that's most likely to alleviate this issue right now is going to be X, Y, Z. And we're going to do that, and we're going to look at it from a very strategic system level perspective. So you won't hear an org site come in and go, yeah, you just need to refer your staff to an employee assistance program, or just whack in a policy or procedure here or there. What we're going to be really looking at is, you know, how do you manage changes more effectively to alleviate the risks that that change is going to result in immense stress or job insecurity, all those kinds of things for staff. How do you develop your leaders? How do you get your teams working together more effectively? How do you design jobs? All of those kinds of things is what we really do, and that's what we're trained to do, and that's what we study for when we do our master's degrees.